Perfect.
You see it?
Perfect. Okay. Okay, so welcome to the American Academy of Emergency Medicine and Women in Emergency Medicine section webinar. Tonight during our webinar, we will discuss burnout, stress reduction, and physician coaching with the experts, the whole physician team. My name is Dr. Danielle Goodrich, and I'm the chair of Women in Emergency Medicine. We'll be leading tonight's discussion. Tonight's discussion will be uploaded and recorded to WiEM Women in Emergency Medicine's website and will be available in the next week for our members. The session is meant to be interactive, so please post your question and answers in the chat or raise your hand and we can go through them at the end. And then before we begin tonight's discussion, I would like to introduce our panelists. But maybe rather than introducing them, why don't I have them introduce themselves and talk about, one of their favorite interests.
Who do you want to go first? Well, I guess I can. So my name is Dr. Laura Kazir. I'm an emergency physician in Huntsville, Alabama. Amanda and I were residency classmates. We're the only two women in our class at Wake Forest a while ago. So we're PGY 23.
23, we think. Yeah.
And we all identify as burnout survivors. So we've been through the varying degrees of burnout. Some of us left medicine entirely briefly and came back, but we have identified a lot of strategies and tools to help us practice emergency medicine in a way that we enjoy. So I have 4 kids. Those are probably my primary interest, and do a few other things, but probably my favorite avocation is coaching. I think I can say that for all 3 of us. We just really, really love what we do. So that's me.
Yeah. She failed to mention she also started on the side at K-12 leadership school, which takes a little bit of time and quite a feat to do. So I'm Amanda Dinsmore. I am an emergency physician, PGY 23 with Laura. I never did quit, but I started having like physiologic reactions at work, like hives, and like it became clear that this was not just in isolation that I was having hives. It only happened at work. And anyway, I was like, I've done it for 15 years. I don't know if I can do it another 15 years. So it just started me on a journey to like, I wonder what else is out there. So I did a 2-year fellowship in integrative medicine at the University of Arizona. And through that, I realized I don't really want to do that full time. One thing with that is you can't take you either are all in with Medicare or you're not. And I had no intentions of quitting in the ER, which you couldn't do both of those at the same time, the way I was thinking about it. But I found coaching, and coaching made such a huge difference for me. Like, I suddenly don't need my asthma medication as much as I used to. And it just made a huge difference in my life. And one of the big tenets of integrative medicine is you don't get to just tell other people how they need to manage their health. You actually have to be an example. And that cut like a knife, because I would never recommend somebody live the way I was living throughout, most of my emergency medicine career. Anyway, we are all 3 working clinically, and so we're our own proof that this actually is a very useful intervention, and we can't wait to share it with you.
Hi, I'm Dr. Kendra Morrison, and I am also a board certified AM and am working clinically, and actually was one of the ones that left briefly and found coaching because Amanda and I are colleagues in the same shop. And so she was like, hey, you want to look at this and check this out and all the things. So We definitely are huge advocates for coaching because honestly, what is the biggest thing that changed my life was that it just works on you. Because we know that 80% of this is institutional and nothing we can do anything about. We have zero control over what goes on around us and the decisions that are made above us. And coaching really gets down to, what do you want? It's time to take our power back, and it's time to start making steps in order to start living the life that you want to create. So I am also a mom and have 2 kids, and Amanda and I both live in Southwest Missouri and work at the same shop.
Oh, yeah, I forgot. My husband's anesthesia and I also have 2 boys. So I forgot that part. It's a pretty huge part of my life that I just left out. So
Thank you guys so much for joining us. Great to hear about your experiences, and we can't wait to learn from you guys.
okay, do you want me to share my screen? Yep. Okay, here we go then. We will start the presentation. Okay, can everybody see that?
Yep.
Alrighty then.
Okay, well, this is Physician Coaching 101, and it is one of the
That's me. That's me. I screwed it up already. Hang on.
anyways, I'll carry on.
Let's start this
It's
over.
a strategy that we have for working in the dumpster fire that we lovingly, refer to the emergency department, all of the shops that we work in, is the dumpster fire. And as EM physicians, one of our most effective coping mechanisms before coaching was dark humor and memes. So we love sarcasm, we love memes. And so we have scattered some of our favorite memes throughout this presentation. So sit back and enjoy. Who are we? Well, we already told you we're the whole physician. We are all 3 board certified EM physicians and all 3 back to working clinically with a new mindset and a few tools that we want to share with you today. So we're going to look at the problem a little bit. So in Medscape, I'm sure y'all may have seen this or been familiar with it. There was a Medscape survey that actually initially started in around late June through September of 2021, which was about halfway through the pandemic. And it was basically just like this, a survey that was sent out. About over 13,000 physicians responded, and there was about 29 to 30 specialties represented. And then they produced these results, and we were just kind of getting into coaching and our business and everything. So we found it quite compelling, some of these statistics that they reported at that time. Well, they've repeated this about a year later, and they just published the results a few months ago. This time it was about a year later. The sample size was a little bit smaller, just over 9,000, and there was still about 29 or 30 specialties represented. And it was the same. It was a survey method, and they compiled the data. So as you can see, one of the most striking thing was in 2021, the EM took the top spot, not necessarily something we brag about or want to really put out there, but and what was even more disappointing was in 2023, we still hold the top spot, and not just by a little bit, but by a significant percentage. So we're kind of present a few of the questions, just the ones that were most notable to us and kind of how coaching affects that. But as you can see, are more female or male physicians feeling burned out? And as depicted here, 63% of women, relate to feelings of burnout. And we have our own thoughts and hypothesis about why this is. And I'm sure, any of the women that are joined here tonight can relate to just the amount of roles that we have and the hats that we wear. So it's not just that we're physicians on shift in the ER. A lot of us go home and we're wives, moms, sisters, caregivers, all the things. So a lot of what we think why there's such the discrepancy is just the burden that the women carry as trying to be all things and do all things for all people. And we have this kind of pandemic of ourselves, this silent suffering that just we're not talking about. So the next statistic here that you see is, are you burned out or depressed? And as you can see, for the most part, over half were just the feeling of being burnt out, just this kind of sadness or feeling blue, and not so much relating to an actual clinical depression or having a diagnosis, but even a quarter still feel like they meet the criteria for a clinical depression. So these statistics is like, how long have you felt burnout? And, you know, there's greater than 2 years, and that's almost a third, all the way down to 1 to 6 months, and it's about 12%. But then when you look at where they ranked how severe the burnout was, for the most part, it is impacting overall both women and men in that strong to severe category. And when they allowed them to type in some free text about how it's affecting your life, you can see here, these are direct quotes from physicians that answered. And what was striking was this bottom one in the blue, that only a sociopath could practice as an employee of a large health system and not be burned out. Anyone who cares about patients is doomed to burnout. So just a sad state of affairs. And then what contributes most to your burnout? I'm sure most of you can relate. It's an overwhelmingly 61% says too many bureaucratic tasks. So even looking back to the data results in 2021, it was the same. And this is what we're talking about, the advent of the EMR, and then just more clicks, and then patient messages and following up and all of this. And especially in EM, that we're just doing a lot more of these phone calls and consultants and social workers. And we just feel like we are not just clinically diagnosing and, you know, treating patients anymore. We're the social worker, we're the chaplain, we're the patient advocate, so that kind of also rolls into that bureaucratic task. And as you can see, some of the free text responses just allude to that. Administration does not take into account the hours we spend on answering patient messages, calls, and filling out paperwork for some of our, you know, clinic-based colleagues. So then when we look at the percentage of physicians who are actually depressed, as you can see, this is just another representation of that. About 2/3 just have that colloquial depression, which is feeling down, blue, or sad, but still a quarter are still feeling that severe depression that lasts, you know, for the amount of time that you could clinically be diagnosed with depression, you know, greater than 6 months to a year. And it does affect our relationships. And what I love about this free text box is it's put a strain on marriage and family. And because I'm irritable and short-tempered, and even the dog avoids me. So it's a sad day. It's a sad day. So how do we cope with burnout? Well, you know, the top spots are actually fairly reasonable and healthy ways to cope. Exercise, you know, have a good support system, and sleep. But then when you kind of go down, there's still a quarter that are, you know, binge eating, drinking alcohol, using prescription drugs and other things. And I'm not sure what the none of the above means, but they're getting creative. So and then what have you done to alleviate your burnout? You know, almost a third have reduced work hours. You know, a quarter of them were meditating and praying or having some, you know, our own self-care practice. But interesting enough that there's about a quarter, 26%, that have done none of the above or nothing. And why do we think that? Well, if you can see here, when they were directly asked, like, have you sought professional help to reduce burnout, anything, there was about half that said no, but would consider. And then as you can see here, the follow-up question is why have you not sought help? It seems to be affecting everything in your life, including how you are clinically. And of course, most of you can relate. The over half said depression says something negative about me. So we talk about that stigma associated with mental health. And if you're just not keeping it all together, then what does that say about me? And then there's that 41 and 42%, which is the other one we can relate to. What are people going to think about me, and how I can, you know, what about how I can perform as a clinician, and what is my medical board or my employer going to find out? What is the repercussion from that? So we see that very commonly, and that's a real fear.
Yeah, what does it mean about me that you're a human being working in a dumpster fire?
That's what we say. So as you can see, these were just some real statistics just to give you perspective, a little bit of what you guys probably already can relate to, but also what nationally, not just EM physicians, but all physicians. It's a real problem. It started well before the pandemic, and it continues today. And so part of what we hope that you'll get out of this presentation tonight is just a real tools that you can start even today to turn things around and start to create your best life. So Laura, take it away.
Okay, so that was a lot of maybe not so great news, but there is some good news in that we do have a new modality to help prevent and reduce symptoms of burnout, and that is coaching. So, what is coaching anyway? I tell you what, if you had ever told me that I would be a coach one day, I would have laughed because I thought that was weird. And for like baseball players who couldn't stay sober or something, but what it is amazing. And it is a group of mindset tools that has been used in business and sports for decades. You know, anybody working in the C-suite of your hospital, they likely have a coach. And so it's really crazy that we work in arguably the most stressful environment in the hospital, and we get no support of that sort. But a coach is not a therapist. A coach partners with a client in a thought-provoking and creative process to create a better life. Basically, we help you examine your own mind and examine your own beliefs and thoughts and help you determine what you want to do with them. We believe that our clients are whole, capable, and resourceful, meaning they have everything they need to help create what it is that they want in their lives. And coaching is based really in positive psychology and cognitive behavioral techniques. One of our clients is actually a psychiatrist, which was kind of funny for us when she joined our program, but she loved what coaching does so much that she actually decided to pursue becoming a coach herself, because she says it's basically like cognitive behavioral therapy light. So it's really focusing on our thoughts and how they drive the rest of what's happening in our lives. So how's it different? So as I mentioned, we're not therapists. It's not technically mental health care. So it's not something that if on your state licensing application you have to report something like that, you don't report it. It's really like professional development. We're not mentors, we're not advisors, there's no stigma, because it's all about personal growth and professional development. As I mentioned, there's no EMR, and it's just a safe space to be vulnerable and really help process a lot of the things that we experience at work that historically EM docs have just kind of shoved down. I'm gonna try. This is my favorite meme. So how can it help? It helps by helping us uncover limiting beliefs. A lot of us have things that we have thought our whole lives, either on a conscious or subconscious level, that we thought were true that maybe are not, and are maybe not helping us. Among women physicians in particular, we see a lot of thoughts about our own self-worth that are not correct. We deal with a lot of imposter syndrome, things like that. Just a lot of false narratives that we may have about ourselves. And presenting our thoughts to a coach helps us to evaluate them objectively and really kind of in a scientific way. Is this actually true? And if it's not, do we actually want to keep thinking that? We teach tools to help us navigate life and career better. Lots and lots of different tools based in positive psychology, and there's more coming all the time. We teach tools also to help decrease unnecessary suffering. I know for me personally, before my burnout episode, I was creating a lot of my own suffering, and understanding that I had more control and power over my situation than I thought was transformational for me, and it is for our clients as well. Coaching helps improve outlook. 100% of people we had a little study that we did in our client group, and 100% of them felt more hopeful at the end of it. So we definitely believe it helps improve your outlook, and it helps you design and create your future. So coaches work on lots of things with people to help create the life that they want. So these are some of the commonly addressed topics. I mentioned imposter syndrome. Perfectionism is one we see in physicians a lot, and we have a lot to say about that. But I won't go into that right now. But a lot of us suffer with perfectionism, and it doesn't do us any favors. Burnout, relationships. We work with people with their home and work relationships quite a bit. Time management, healthy and bad habits. So if we're trying to improve our sleep, or if we're trying to improve our eating habits or adopt new exercise routines or whatever, a coach helps provide accountability for those kind of things. Your relationship with money, or anything really that you feel stuck in, a coach can help you with. I go to my coach a lot for things where I feel annoyed and I can't figure out why. And she helps me to get to the bottom of it. So anything you really want to talk about. When coaching isn't appropriate, it's really the deep therapy stuff that you need an actual therapist for. Like if there is, physical, mental, sexual abuse happening, that needs to go to a therapist. If there's anxiety or depression that's making your day-to-day living difficult, like you can't get out of bed because you're so depressed, or suicidal. Obviously, if we're suicidal, we need to go get some emergency help with our physician or psychiatrist. Letting go or processing trauma. So if there's past trauma and you need something like EMDR, special trauma treatment techniques, those go to a therapist. So the exciting thing is we know it works. It has worked for us and it works for our clients, but we also love to see evidence. And there have been several trials. I'm going to just talk to you about these briefly, and more coming. So the first trial was done by Mayo, and their intervention, this was done with attending physicians. They provided 6 coaching sessions, and these were with general life coaches. These were not with physicians, life coaches. So life coaches, 6 sessions. The first was an hour and then 5 30-minute sessions. And you can see that they saw improvement in emotional exhaustion, burnout, resilience, and in quality of life. So the next study was done at McLean, which is a Harvard affiliate hospital. And in this, they did the same 6 sessions, but then they measured again at 6 months, and it showed that the improvements were sustained over that 6-month period. And then Stanford did a study, and in this study, this is again with attendings, they were able to note that there was improvement even after 4 sessions. And I can say I wouldn't be surprised if they did a study where there was improvement after 1 session. This is why we love it so much, because there's visible relief on our clients' faces after even just talking for 30 minutes. It's amazing. And then this University of Colorado study was done with residents. It's the only one done with residents, and it was done with group coaching. And again, they had improvement in emotional exhaustion, imposter syndrome, and self-compassion. So science is backing this up, and we're just excited that there's something effective out there and happy to be a part of it. And now, Amanda, tell us how to get out and stay out of the dumpster.
All right. Well, we talked about preventing unnecessary suffering, and this is an example from my previous life. So I'm telling on myself, and you can walk a mile in previous Amanda's shoes. So the first concept that we're going to talk about, this is a famous quote from Viktor Frankl, between stimulus and response, there is a space. In that space is our power to choose our response. In our response lies our growth and our freedom. So coaching is based on the cognitive thought model, which is that there's this situation, right? There's a stimulus and a response, like Viktor Frankl said. But in the middle, there's thoughts and emotions. The stimulus causes a thought, which leads to an emotion, and your behaviors are driven from the emotions that you're having. If you're angry, you act in a certain way. If you're at peace, you act in a certain way. So it's this space that we're harnessing, the space that Viktor Frankl is talking about, that we're harnessing on purpose with coaching. Your thoughts and your beliefs are based on past experience, and they're not always relevant for now or the future. Your brain has picked up some lessons from your past, and there's no reason for it to challenge itself unless you're doing it on purpose. One of the classic experiments proving this is the experiments on learned helplessness in 1967 by Marty Seligman. There was a group of dogs that got shocked. One of the sets of dogs, if they did a certain movement or whatever, they could stop the shocks. The other set of dogs, it didn't matter. It was just random shocks, didn't matter what they were doing. And it came out in part 2 of the study. They put both, if you see the picture there, they put both sets of dogs on the side where the current dog is. There's a tiny partition there that they can easily walk over. The dogs that had learned that they had some control over the shocks when they got shocked on this new apparatus simply got up and left. It was easy for them. And dogs that had never been shocked jumped the heck out of there instantly. The dogs who had learned in the past that they had no control over the shocks didn't even try to escape. They laid down and took the shocks. This is an upsetting experiment, and I'm told, I'm not even going to look to try to verify it, but supposedly they untrained these dogs and they're all happy dogs. That's what we're gonna, I don't really like dog studies, but anyway, same idea. The thoughts and beliefs you have about something are from your past, and not always does it apply to today, and for sure it doesn't apply to the future. The second concept that we need you to know is about the motivational triad. Our brains have evolved to survive, and that has served us incredibly for millions of years. It's only in the past couple hundred years that we aren't having to scavenge for food and, you know, deal with weather and deal with all of these sorts of things. In fact, everything is so easy for us now. But for millions of years, it really served us to have this motivational triad. Number 1, avoid pain. Number 2, seek pleasure. And number 3, conserve energy. Our brains use an incredible amount of energy. And so if you have a habitual thought that has taken hold in your brain, that's just your brain's default. It's just a habit. It's not a big deal, but it saves it a lot of energy if it's like, I kind of recognize this situation, let's offer up this thought. And what we use in coaching is neuroplasticity. If you have an automatic negative thought, or you have a thought that's just automatic for you, if you become aware of that and realize it's not serving you, it's not giving you the results that you want, you can on purpose start to rewire your brain. You can catch yourself in that thought loop, stop it, and then on purpose choose the new one that you want to become your default loop. And just like, you know, the very first few times that you do it, it's like putting the gravel down for the gravel road, then maybe you put some chip and seal down, but eventually that new intentional thought becomes your automatic superhighway thought. And the one you're on purpose avoiding shrinks and goes away, or is not a big deal at all anymore. Takes time because neurons take time, but it's possible. So what do we want? We want serenity now. The goal of coaching is to challenge those limiting beliefs, the ones that aren't serving us, and just decide, do I want to keep this or do I want to replace it with something else? So here we go. Let's coach young Amanda. All right, just to revisit, this is our cognitive thought model. There is a circumstance or stimulus that's outside of us, right? It's just the facts of our lives. It's our thoughts about it that give us the feeling that we have. From those feelings, that determines the actions or inactions that we take. The sum total of all of those give us the results. So step 1 in a coaching session, if you're self-coaching or if you're going to another coach, at least the way we do it, is you just do a thought dump. You get it all out. This is not where you're trying to be positive Polly. It's good to know what's in there. I freaking hate this. This is so stupid. You know, it is. I mean, some of us are so uncomfortable with our negative emotions that we're not honest with ourselves to like actually find out what's in there. So step 1 is just getting it all out on paper or verbally or talking with your coach. And sometimes the stuff in there is like shocking. Like, oh, wow, no wonder I feel terrible. Okay, so this was a typical, at one point in my career, I was all nights because my husband's anesthesia, so he's mostly days. So if I was nights, then we didn't need as much childcare sort of stuff. So let me tell you, the day before my night shift and the entire day before my night shift, this is what went on. I can't believe I have to go to work today. That place is an absolute dumpster fire. We're understaffed. I have to work with so-and-so who's a total jerk. He's so lazy. He doesn't pick up his fair share. And I have to do it all. It's going to be 10 hours of misery. This is going to suck. And I usually would throw into, like, why wasn't I just born a lady of leisure? You know, I was very dramatic. So next step in coaching is let's find the actual facts. All of this business on this page is not a fact except for that I am scheduled to work today. Also on the schedule is so-and-so. And our schedule where we worked, it was 10 hours. The whole rest of it is, oh. Okay, but you might say, well, I do have to go to work. No, you don't. It's tons of people that just walk out one day and never come back. People do it all the time. Not a lot of docs do it, but you could. Unless somebody's dragging you in, you are voluntarily putting the key in the car and driving to work. Saying that you have to is very disempowering when you're doing it because you like electricity and vacations and your coworkers maybe. Maybe you don't want to screw them over and not show up, but it is your choice. You have the power. Understaffed is a little problematic because is that 2 nurses with spots for 14, or is it 10 nurses with spots for 14? Understaffed, we just need more information. Jerk and lazy is not, we would not consider that quite down to the facts yet because everyone on earth has to agree, including said jerk and jerk's mother. Probably they don't agree with that. So that's a thought of mine. Fair share is problematic. What does that mean? Is it the amount that so-and-so can pick up before it starts getting confused? Is it every other? Fair share is just a label on it. It's not clear what that means. I have to do it all. Like, come on now, Amanda, that's a bit much. And then misery and this is going to suck. Those are all just thoughts that I had. It's not facts. So next step. Let's challenge those thoughts. Are these things even true? Some of those things weren't even true. If it is true, is there any benefit whatsoever to me thinking this? And of all of the thoughts on the planet, why am I choosing these? Is it possible that there's another perspective to consider? It's just on purpose realizing what's in there and then really looking at them and see, is this fact or is there a little wiggle room there? So if we get down to the nitty gritty, the circumstance or the facts is 10-hour shift. It's today working with so-and-so. There's 10 nurses with 14 slots available. When I think the thought, this is going to suck, it brings up in me dread. And you all, I would have like full blown, a lump in my throat going to work. I was crabby all day. I mean, I was physiologically living the dread of going to work. Okay. So the actions of what come from my feeling of dread, look for evidence of how work sucks, ignore any evidence of it not sucking. For sure, I'm not bringing up all of those times that I actually had a great time at work. I'm future tripping. That is just a fancy way of saying I'm pre-living the suck and I'm not enjoying the present moment. So the result of this thought, it is going to suck, brings about a lot of suck in my life. And it honestly didn't even have to do with work because I'm not even at work. I am pre-living this because of my own thoughts. I'm not even there and I'm ruining my own day, right? So I don't like this thought for me. And I've stopped doing it. I've started telling myself, even if it does, I can live it one time. I don't have to pre-live it 1,000 times. That has really helped me personally. So that's just one example of like 80,000 problematic thoughts that I've worked on with coaching in my own self. I'm my own case study. But we just are so interested in anyone that we could possibly help. Emergency medicine is the lifeguards of the shallow end of the gene pool, and we need all of us, as many of us that can, stick around, love to have you. So our main thing is we want you to take care of you. truthfully, I don't think there's any more important people on the planet than you all.
Nope.
That is what I think. So that's the end. That's the example of kind of how coaching works. And so if there's any questions, this is the time.
Thank you
Oh.
guys. Oh,
I'm not paying attention to the chat because I have my.
I was gonna say there's nothing in the chat. Thank you
Okay.
guys so much. I have a few questions that I think would be beneficial for everybody. So you kind of alluded to it in one of your slides, but you guys talked about some studies that you looked at. I was just wondering, do you have similar results to some of those studies? Do you guys have your own internal data that you guys have collected in terms of kind of your guys' coaching techniques?
Yes. And I'm glad you asked that, because just in case, I made a little summary of it. There was a critical access hospital in California that found us. Their wellness committee, I was super impressed, wanted to sponsor a little pilot study. It's really small hospital. So there were 8 in their cohort. And basically they did the same as our coaching, our CME course in coaching. We didn't have CME at that time, but it was the same. It was the first iteration of that. It was 12 weeks of topics on video that played on it. They could do that on their own time, but it's 12 of the things that we see over and over and over in our own physician clients, and it's just on your own time. So it was that, and then it was 6 private coaching sessions, just like the Mayo Clinic and the McLean Hospital studies. So we just, since it was the first time that we were doing a study like this, we were like, let's just go with the first 2. So they got 6 sessions. And we surveyed them using Maslach burnout inventory, Neff self-compassion scale, and then the Stanford professional fulfillment self-assessment. And I'll tell you, that was also because I asked, there's not very many of us physician coaches, and we kind of talk to each other a lot, and they were just starting a survey at UCSF, and that's what they were using. So I was like, they've done the work, let's just use the same surveys. And so with 8 an N of 8, that's too small to tell anything for sure, but it just does not seem like an accident that of all 80 questions of those 3 surveys, every single one of them went in the right direction. Some of them not by much at all, but all of them went in the direction that you would hope for. So that was, to me, not an accident, but the most significant improvements that we saw were feeling more worthwhile, feeling more in control, less dread, taking care of their own health, not feeling emotionally drained and used up, less fatigue, less burned out, not being consumed with feelings of inadequacy, which is huge, and not getting down on themselves. That, to me, was, I mean, we take care of patients and it's incredibly meaningful, but it is even more meaningful for me to be taking care of us. Like, I feel like there are lots of people that take care of patients, but I don't know that many people that are trying to take care of us. So even just seeing this in such a small study was very gratifying for us. And then in the post-course survey, this wasn't part of a formal survey, but 100% of the course participants felt that the course had helped them. The majority felt happier, less stressed, more empowered, less burned out. 100% felt more hopeful, and 100% would recommend the course to colleagues if their hospital provided it. So that was incredibly gratifying for us.
Wonderful. It's so good to hear that people are benefiting from all of this. I'm glad that we can bring it to our members. Do you guys have any free resources that you guys have developed or that we can send to our members that might be interested in getting started?
Yeah, absolutely. As a matter of fact, we have a podcast that we're super excited because we celebrated our 1-year anniversary in March, and we have had so much great feedback It's called the Drive Time Debrief with the Whole Physician. We drop an episode every Thursday. We've had some fantastic guests on that have just brought a lot of perspective in their areas of specialty, but also in what they're passionate about. And so you can check us out on any of the streaming tools like Apple or Spotify or Google. And then we also write an article for Emergency Medicine News. So if you want to copy that QR code, that will take you to our Wellness 911 column, and you can check out a few of our articles, and you'll soon be seeing us in Common Sense. So we're super excited to be able to contribute to Common Sense in the wellness space. And as always, if you have any questions, there's our direct email, and then check out our website. And just for women in emergency medicine, and just for listening to this awesome webinar tonight and everyone that's joined us, we are going to give you a 30-day access to our signature course, which y'all can appreciate, is called What's the ICD-10 Code for Injury Sustained in a Dumpster Fire? So this is backed by popular demand. We had a lot of great feedback. It's an amazing course. It's quick. It's 30 minutes of your time to just enjoy these 3 short modules and a few reflection questions at the end. And so we'll make this QR code available to the entire group, but that's how you get access. And it's not a lot of time. It's a quick thing, but like you can see here, one of our participants in their testimonial at the end said, pointed out and actually went out of their way to comment that they learned more in our 30-minute program concerning burnout than their 30-year medical career. So just overwhelmingly, like I said, a little bit of time and a little bit of awareness and just big time impact, and definitely changing the trajectory of several EM physicians from basically wanting to leave medicine altogether to going back to the career that they worked so hard for and once loved, and just getting just more excited about it.
Thank you guys so much. That's an amazing offer and opportunity for our members. I have one last question, and I think this definitely relates to me, maybe others in the group, but someone's on the fence, thinks it's a really great opportunity, but just isn't ready to commit. Any thoughts or anything that you would say, should we start with this mini course or jump straight in?
So what I would say is that you have been practicing emergency medicine for a varied amount of time. And during that time, we're accumulating stress, that secondary traumatic stress. We're accumulating ideas about ourselves that may not be correct. And we need to find a place to process that stuff so that it doesn't have an effect on our emotional, professional, or even physical health. I shoved stuff down for so long, and I swear it gave me several autoimmune diseases that I have now. So don't be like that. Find a place to process it. Coaching is a great place to do it. There are lots of wonderful physician coaches, other coaches. We, of course, love coaching. We coach all different kinds of physicians, but our heart really is to coach emergency physicians. You really have nothing to lose, especially with us. We offer a free consultation. We offer, the free mini course. We offer a money back guarantee. If anybody tries it and doesn't feel like it's for them, or if it doesn't really help them, which has not happened at all, you have 30 days to say, it's not really for me. So, and we just really want our EM colleagues especially to please find a place to process what you're experiencing at work, and make sure that you stay healthy in all the ways. So you've got nothing to lose. So that would be what I would say. All you have is, I guess you have 30 minutes to lose, but so much to gain in terms of relief and creating longevity in your career and creating really the life that you want.
I would say too, and this again, apparently today I'm on the dramatic side, but you would never send somebody into battle without any gear or armor. But I feel like that's what happens to us in medicine. You finish residency and it's here, fly. except for no one has given me, I knew how to take care of patients, I just didn't know how to take care of me. That is the part that I felt like was missing in my training. And that is the part that we're trying to complete, that void, at least. I hope it's different. Like I hope that it is, but that was my experience. And so
You know,
that is,
I thought of one other thing too that might be something that would make someone hesitant. It would have made it did make me hesitant, is that, you know, I don't want, like, I just don't even want to talk about this, and I certainly don't want to talk about it with someone who's like not even going to understand me.
right.
I can assure you that physician coaches get it. We don't realize it because we often feel alone, but so many of us struggle with the same things over and over. And what you find in a coaching session is so much compassion, so much understanding, and perspective to help you get out of whatever hole you find yourself in.
Thank you, guys. There's one question from the chat. I'll read it. I think there's still time, 5:47. Yep. Have you had any partners of EM physicians take your course, for example, to be a better help to their physician partner?
So does that question mean like domestic partner? Was that the question?
So I think I think most of our clients are physicians that we meet with or have taken our course. But interestingly enough, we did have a resident auxiliary group reach out, and they were actually the spouses or partners of all residents going through at a program. I think it's in Pennsylvania, where it's a conglomeration of programs. And so they reached out wanting to not only have something that they could attend, but also be able to offer to their like partners and spouses that are actually going through residency. So that was interesting. And so out of that, we were able to give them several options for not only the spouse or the partner to attend, but also for the residents going through residency.
Yeah. I mean, our niche is physicians, but we've certainly had clients that were not physicians. It's just not who we're targeting, because we're targeting the people who nobody is taking care of. You know, but yes, as long as it is one-on-one individual coaching, then yeah, you could be somebody other than a physician. That is not a problem. But when we start our group coaching, we will want it to be only, you know, like people with like people, just for safety and for not safety like physical safety, but like, you know, emotional safety.
Okay, thank you for answering that. Any last questions? You can feel free to post it in chat. Otherwise, thank you all for attending tonight's session. To register for upcoming webinars, and please visit our website where this will be posted as well. And we'll be sending out this QR code to our members. And to our fabulous speakers, thank you so much for taking the time to talk with us, share your experiences, your coaching techniques, and really get us all thinking about how we can take care of ourselves. So any last comments? Otherwise, I'll end it for tonight, and thank you again.
No, thank you for having us. And
Yeah,
Thank
our
you for having
pleasure.
us.
Yeah,
everybody take care.
thank you.
Have a good night, everybody. Thanks for joining. Bye.
Bye.